Hi everybody, this video of mine is about epilepsy, which is a central nervous system or neurological disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Anyone can develop epilepsy. Epilepsy affects both males and females of all races, ethnic backgrounds, and ages. Seizure symptoms can vary widely. Some people with epilepsy simply stare blankly for a few seconds during a seizure, while others repeatedly twitch their arms or legs. Having a single seizure does not mean you have epilepsy. At least 2 unprovoked seizures are generally required for an epileptic diagnosis. Treatment with medications or sometimes surgery can control seizures for the majority of people with epilepsy. Some people require lifelong treatment to control seizures, but for others the seizures eventually go away. Some children with epilepsy may outgrow the condition with age. Now let me tell you the symptoms. And because epilepsy is caused by abnormal activity in the brain, seizures can affect any process your brain coordinates. Seizures with signs and symptoms include temporary confusion, a staring spell, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness, psychic symptoms such as fear, anxiety, or déjà vu. Symptoms vary depending on the type of seizure. In most cases, a person with epilepsy will tend to have the same type of seizures each time, so the symptom will be similar from episode to episode. Doctors generally classify seizure as either focal or generalized based on how the abnormal brain activity begins. Now let me tell you about focal seizures. When seizures appear to result from abnormal activity in just one area of your brain, they are called focal or partial seizures. These seizures fall into 2 categories: focal seizure without loss of consciousness. Once called simple partial seizures, these seizures do not cause a loss of consciousness. They may alter emotions or change the way things look, smell, feel, taste, or sound. They may also result in involuntary jerking of a body part such as an arm or leg, and spontaneous sensory symptoms such as tingling, dizziness, and flashing lights. And the second form is focal seizures with impaired awareness. Once called complex partial seizures, these seizures involve a change or loss of consciousness or awareness. During a complex partial seizure, you may stare into space and not respond normally to your environment, or perform repeated movements such as hand rubbing, chewing, swallowing, or walking in circles. Symptoms of focal seizures may be confused with other neurological disorders such as migraine, narcolepsy, or mental illness. A thorough examination and testing are needed to distinguish epilepsy from other disorders. Coming to the generalized seizures, seizures that appear to involve all areas of the brain are called generalized seizures. 6 types of generalized seizures exist. These are absence seizures. Absence seizures, previously known as petit mal seizures, often occur in children and are characterized by staring into space or subtle body movements such as eye blinking or lip smacking. These seizures may occur in cluster and cause a brief loss of awareness. Secondly is tonic seizures. Tonic seizures cause stiffening of your muscles. These seizures usually affect muscles in your back, arms, and legs and may cause you to fall to the ground. Third type is atonic seizures. And these I'm discussing generalized epilepsy. Okay. Atonic seizures, also known as drop seizures, cause a loss of muscle control which may cause you to suddenly collapse or fall down. Fourth is clonic seizures. Clonic seizures are associated with repeated or rhythmic jerking muscle movements. These seizures usually affect the neck, face, and arms. Myoclonic seizures. Myoclonic seizures usually appear as sudden brief jerks or twitches of your arms and legs. 6 is tonic-clonic seizures. Tonic-clonic seizures, previously known as grand mal seizures, are the most dramatic type of epileptic seizure and can cause an abrupt loss of consciousness, body stiffening and shaking, and sometimes loss of bladder control or biting your tongue. You should seek immediate medical help if any of the symptoms which I am going to tell you which occur. Okay, if the seizure lasts more than 5 minutes, breathing or consciousness does not return after the seizure stops, a second seizure follows immediately, you have a high fever, you are experiencing heat exhaustion, you are pregnant, you have diabetes, you have injured yourself during the seizures. If you experience a seizure for the first time, seek medical advice. Now let me tell you the causes. Epilepsy has no identifiable cause in about half the people with the condition. In the other half, the condition may be traced to various factors, including genetic influence. Some types of epilepsy, which are categorized by the type of seizure you experience, are the part of the brain that is affected, run in families. In these cases, it is likely that there is a genetic influence. Researchers have linked some types of epilepsy to specific genes, but for most people, genes are only part of the cause of epilepsy. Certain genes may make a person more sensitive to environmental conditions that trigger seizures. Another cause is head trauma. Head trauma as a result of car accident or other traumatic injury can cause epilepsy. Brain conditions that cause damage to the brain, such as brain tumor or strokes, can cause epilepsy. Stroke is the leading cause of epilepsy in adults older than age 35. Infectious diseases such as meningitis, AIDS, and viral encephalitis can cause epilepsy. Prenatal injury. Before birth, babies are sensitive to brain damage that could be caused by several factors such as an infection in the mother, poor nutrition, or oxygen deficiency. The brain damage can result in epilepsy or cerebral palsy. Developmental disorders. Epilepsy can sometimes be associated with developmental disorders such as autism and neurofibromatosis. Now coming to the risk factors. Certain factors may increase your risk of epilepsy, such as age. The onset of epilepsy is most common in children and older adults, but the condition can occur at any age. Family history. If you have a family history of epilepsy, you may be at an increased risk of developing a seizure disorder. Head injuries. Head injuries are responsible for some cases of epilepsy. You can reduce your risk by wearing a seat belt while riding in a car and by wearing a helmet while bicycling, skiing, riding a motorcycle, or engaging in other activities with a high risk of head injury. Stroke with other vascular diseases. Stroke and other blood diseases can lead to brain damage that may trigger epilepsy. You can take a number of steps to reduce your risk of these diseases, including limiting your intake of alcohol and avoiding cigarettes, eating a healthy diet, and exercising regularly. Dementia. Dementia can increase the risk of epilepsy in older adults. Brain infection. Infections such as meningitis, which cause inflammation in your brain and spinal cord, can increase your risk. Seizures in childhood. High fever in childhood can sometimes be associated with seizures. Children who have seizures due to high fever generally won't develop epilepsy. The risk of epilepsy increases if a child has a long seizure, another nervous system condition, or a family history of epilepsy. Now I'll tell you some of the complications. Having a seizure at certain times can lead to circumstances that are dangerous to yourself or others, such as falling. If you fall during a seizure, you can injure your head or break a bone. Drowning. If you have epilepsy, you are 15 to 19 times more likely to drown while swimming or bathing than the rest of the population because of the possibility of having a seizure while in the water. Car accidents. A seizure that causes either loss of awareness or control can be dangerous if you are driving a car or operating other equipment. Many states have driver license restrictions related to the driver's ability to control seizures and impose a minimum amount of time that a driver be seizure-free, ranging from months to years before being allowed to drive. Pregnancy complications. Seizures during pregnancy pose danger to both mother and baby, and certain anti-epileptic medication increase the risk of birth defects. If you have epilepsy and you are considering becoming pregnant, talk to your doctor as you plan your pregnancy. Most women with epilepsy can become pregnant and have healthy babies. You will need to be carefully monitored throughout pregnancy, and medication may need to be adjusted. It's very important that you work with your doctor to plan your pregnancy. Emotional health issues. People with epilepsy are more likely to have psychological problems, especially depression, anxiety, and suicidal thoughts and behaviors. Problem may be the result of difficulty dealing with the condition itself as well as medication side effects. Other life-threatening complications of epilepsy are uncommon but may happen, such as status epilepticus. This condition occurs if you are in a state of continuous seizure activity lasting more than 5 minutes, or if you have frequent recurrent seizures without regaining full consciousness in between them. People with status epilepticus have an increased risk of permanent brain damage and death. Sudden unexpected death in epilepsy, that is SUDEP. People with epilepsy also have a small risk of sudden unexpected death. The cause is unknown, but some research shows it may occur due to heart or respiratory conditions. People with frequent tonic-clonic seizures or people whose seizures are not controlled by medication may be at higher risk of sudden unexpected death in epilepsy. Overall, about 1% of people with epilepsy die of SUDEP. Now I'll tell you the diagnosis of epilepsy. And generally, patient come to us, we review your symptom and medical history. We may order several tests to diagnose epilepsy and determine the cause of seizures. Your evaluation may include a neurological exam. We may test your behavior, motor ability, mental function, and other areas to diagnose your condition and determine the type of epilepsy you may have. Blood test. We may take a blood sample to check for signs of infection, genetic condition, or other conditions that may be associated with seizures. We may also suggest tests to detect brain abnormalities. These are specialized tests for epilepsy. The first important test is electroencephalogram, also known as EEG. This is an abbreviation for this. This is the most common test used to diagnose epilepsy. In this test, electrodes are attached to your scalp with a paste-like substance or cap. The electrode records the electrical activity of your brain. If you have epilepsy, it's common to have changes in your normal pattern of brain waves even when you are not having a seizure. Your doctor may monitor you on video when conducting an EEG while you are awake or asleep to record any seizure you experience. Recording the seizures may help the doctor determine what kind of seizure you are having or rule out other conditions. The test may be done in a doctor's office or the hospital. If appropriate, you also may have an ambulatory EEG which you wear at home while the EEG records seizure activity over the course of a few days. Your doctor may give you instruction to do something that will cause seizure, such as getting little sleep prior to the test. High density EEG. In a variation of EEG test, your doctor may recommend high density EEG, which spaces electrodes more closely than conventional EEG, about half a centimeter apart. High density EEG may help your doctor more precisely determine which areas of your brain are affected by seizures. The next test is computerized tomography or CT scan. A CT scan uses X-rays to obtain cross-sectional images of your brain. CT scan can reveal abnormalities in your brain that might be causing your seizures, such as tumor, bleeding, and cysts. MRI. MRI uses powerful magnets and radio waves to create a detailed view of your brain. Your doctor may be able to detect lesions or abnormalities in your brain that could be causing your seizures. Functional MRI measures the changes in blood flow that occur when specific parts of your brain are working. Doctor may use a functional MRI before surgery to identify the exact locations of critical functions such as speech and movement so that surgeon can avoid injuring those places while operating. Positron emission tomography, that is PET scan. PET scan uses a small amount of low-dose radioactive material that is injected into a vein to help visualize active areas of the brain and detect abnormalities. Single photon emission computerized tomography, that is SPECT. This type of test is used primarily if you have had an MRI and EEG that did not pinpoint the location in your brain where the seizures are originating. A SPECT test uses a small amount of low-dose radioactive material that is injected into a vein to create a detailed 3D map of the blood flow activity in your brain during seizures. Doctor also may conduct a form of SPECT test called subtraction ictal SPECT, categorized to MRI SYSCOM, which may provide even more detailed results. Neuropsychological test. In these tests, doctors assess your thinking, memory, and speech skills. The tests help determine which areas of your brain are affected. Along with your test results, your doctor may use a combination of analysis techniques to help pinpoint where in the brain seizures start. Statistical parametric mapping (SPM) is a method of comparing areas of the brain that have increased metabolism during seizures to normal brain, which can give doctor an idea of where seizures begin. Curry analysis. Curry analysis is a technique that takes EEG data and projects it onto an MRI of the brain to show doctor where seizures are occurring. Magnetoencephalography (MEG). This measures the magnetic field produced by brain activity to identify potential areas of seizure onset. Accurate diagnosis of your seizure type and where seizures begin give you best chance of finding an effective treatment. Now coming to the treatment, doctors generally begin by treating epilepsy with medication. If medication don't treat the condition, doctor may propose surgery or another type of treatment. Medication. Most people with epilepsy can become seizure-free by taking one anti-seizure medication, which is also called anti-epileptic medication. Others may be able to decrease the frequency and intensity of their seizure by taking a combination of medications. Many children with epilepsy who are not experiencing epilepsy symptoms can eventually discontinue medication and live a seizure-free life. Many adults can discontinue medication after 2 or more years without seizures. Your doctor will advise you about the appropriate time to stop taking medications. Finding the right medication and dosage can be complex. Your doctor will consider your condition, frequency of seizure, your age, and other factors when choosing which medication to prescribe. Your doctor will also review any other medication you may be taking to ensure the anti-epileptic medication won't interact with them. Your doctor likely will first prescribe a single medication at a relatively low dosage and may increase the dosage gradually until your seizures are well controlled. Anti-seizure medication may have some side effects. Mild side effects include fatigue, dizziness, weight gain, loss of bone density, skin rashes, loss of coordination, speech problem, memory, and thinking problems. Most feared but rare side effects include depression, suicidal thoughts, and behavior, severe rash, inflammation of certain organs such as liver. To achieve the best control possible with medication, you should follow these steps. Take medication exactly as prescribed. Always call your doctor before switching to a generic version of your medication or taking other prescription medication, over-the-counter drugs, or herbal remedies. Never stop taking your medication without talking to your doctor. Notify your doctor immediately if you notice new or increased feeling of depression, suicidal thoughts, or unusual changes in your mood or behavior. Tell your doctor if you have migraines. The doctor may prescribe one of the anti-epileptic medications that can prevent your migraines and treat epilepsy as well. At least half the people newly diagnosed with epilepsy will become seizure-free with their first medication. If anti-epileptic medication don't provide satisfactory results, your doctor may suggest surgery or other therapies. You will have regular follow-up appointments with your doctor to evaluate your condition and medications. Now I'll tell you some examples of anti-epileptic drugs. These common types include sodium valproate, carbamazepine, lamotrigine, levetiracetam, oxcarbazepine, ethosuximide, topiramate. The next option of treatment, which is rarely done, is surgery. When medication fails to provide adequate control over seizures, surgery may be an option. With epilepsy surgery, a surgeon removes the area of your brain that is causing seizures. Doctor usually performs surgery when tests show that your seizures originate in a small, well-defined area of your brain. The area in your brain to be operated on does not interfere with vital functions such as speech, language, motor function, vision, or hearing. Although many people continue to need some medication to help prevent seizures after successful surgery, you may be able to take fewer drugs and reduce your dosages. In a small number of cases, surgery for epilepsy can cause complications such as permanently altering your thinking, that is cognitive ability. Talk to your surgeon about his or her experience, success rates, and complication rates with the procedure you are considering. There are some other therapies which you may consider. Apart from medication and surgery, these differential therapies offer an alternative for treating epilepsy. The first one is vagus nerve stimulation. In vagus nerve stimulation, doctor implants a device called a vagus nerve stimulator underneath the skin of your chest, similar to a heart pacemaker. Wires from the stimulator are connected to the vagus nerve in your neck. The battery-powered device sends bursts of electrical energy through the vagus nerve and to your brain. It is not clear how this inhibits seizures, but the device can usually reduce seizures by 20 to 40%. Most people still need to take anti-epileptic medication, although some people may be able to lower their medication dose. You may experience side effects from vagus nerve stimulation such as throat pain, hoarseness, shortness of breath, or coughing. Ketogenic diet. Some children with epilepsy have been able to reduce their seizures by following a strict diet that is high in fats and low in carbohydrates. In this diet, called a ketogenic diet, the body breaks down fats instead of carbohydrates for energy. After a few years, some children may be able to stop the ketogenic diet under close supervision of their doctor and remain seizure-free. Consult a doctor if your child is considering a ketogenic diet. It's important to make sure that your child does not become malnourished when following the diet. Side effects of a ketogenic diet may include dehydration, constipation, slowed growth because of nutritional deficiencies, and a build-up of uric acid in the blood, which can cause kidney stones. These side effects are uncommon if the diet is properly and medically supervised. Following a ketogenic diet can be a challenge. Low glycemic index and modified Atkins diet offer less restrictive alternatives that may still provide some benefit for seizure control. Another technique is deep brain stimulation. In deep brain stimulation, surgeons implant electrodes into a specific part of your brain, typically your thalamus. The electrodes are connected to a generator implanted in your chest or your skull that sends electrical pulses to your brain and may reduce your seizures. There are some potential future treatments such as responsive neurostimulation. This is implantable pacemaker-like devices that help prevent seizures are under investigation. These responsive stimulation are closed-loop devices analyze brain activity patterns to detect seizures before they happen and deliver an electrical charge or drug to stop the seizure. Continuous stimulation of the seizure onset zone. Subthreshold stimulation, that is continuous stimulation to an area of your brain below a level that is physically noticeable, appears to improve seizure outcome and quality of life for some people with seizures. This treatment approach may work in people who have seizures that start in an area of the brain that cannot be removed because it would affect speech and motor functions. Or it might benefit people whose seizure characteristics mean their chances of successful treatment with responsive neurostimulation are low. Minimally invasive surgery. New minimally invasive surgery techniques such as MRI guided laser ablation show promise at reducing seizure with fewer risks than traditional open brain surgery for epilepsy. There is another technique that is known as stereotactic laser ablation or stereotactic radiosurgery. For some types of epilepsy, stereotactic laser ablation or stereotactic radiosurgery may provide effective treatment when an open procedure may be too risky. In these procedures, doctors direct radiation at the specific area in the brain, causing seizure to destroy the tissue in an effort to better control the seizure. There is another technique that is external nerve stimulation device similar to vagus nerve stimulation. This device would stimulate specific nerve to reduce frequency of seizure, but unlike vagus nerve stimulation, this device would be worn externally so that no surgery to implant the device is needed.